Catch Health Alert on your schedule, Bakersfield On Demand, Channel 300. When a woman announces that she's having a baby, friends and family immediately start planning a shower, suggesting baby names, and shopping for pink or blue. But there are some side effects you don't hear much about that can be prevented. By the way, the future mom in our story, you just might recognize. Seeing them sleep, grabbing their tiny feet, and watching them grow. This is what most moms-to-be dream of. But conveniently missing from those dreams, varicose veins, spider veins, and stretch marks. Just ask future mom, Eyewitness News anchor, Amity Idrisi.
Now, how did you feel when you first found out that you were pregnant?
I was scared. I was really scared, but I was excited too. It was amazing. It's
not as amazing? The body changes Amity is noticing.
This is just how my body is. I'm not 22 anymore.
Here's the good news. There are things you can do to deal with these unsightly or uncomfortable changes.
Prevention and treatment are now the name of the game, and that's why we're talking more and more about it now.
So let's get into it. Veins. What you may not know is that varicose veins and spider veins are not the same thing.
Varicose veins are deeper veins deep in your skin, and spider veins are small, spider leg looking veins right underneath your skin.
Both can be prevented. Dr. Shah suggests buying compression maternity stockings.
They provide compression on your outer leg so that the veins can't form. Another way to prevent these is to keep your legs elevated.
One more thing you can do to prevent varicose veins and spider veins is to kick off your heels and put on flats, taking as much pressure off your feet as possible. Ready to talk stretch marks? They're caused when the elasticity of your skin can't handle the amount of stretch put on it.
What you see is the epidermis and the dermis of the skin actually tearing apart from each other and thinning out.
Dr. Shah suggests preventing stretch marks in the first place.
One thing that you can do is minimize the amount of stretching on the skin by watching your weight and exercising during pregnancy. Another thing that you can do is to moisturize your skin to help it slide better.
Amity's been using vitamin E oil to hydrate her skin.
I was just rubbing it on so I don't get stretch marks.
The third thing you can do is wear a special girdle, particularly helpful while you're sleeping.
They make much cuter ones, actually.
They're cuter ones?
Yeah, Spanx makes a good one.
The girdle supports your back, but also wraps around your abdomen, holding your skin together in the front. It should cover the baby, but not push it in.
I'm getting used to a lot of things like eating.
Regardless of all the changes Amity is going through, this mom-to-be says this is the most incredible thing that could ever happen.
Knock on wood, so far it's been a good pregnancy, and I feel really blessed. Yeah. Aww, you make me cry.
She's been one of my closest friends for 7 years, so I'm so excited. Amity is about 6 months pregnant, and her advice to first-time moms-to-be, don't be too hard on yourself. Just give yourself a break. Some good advice there. Now, if you've already had a child, or maybe more than one, you may be dealing with the problem of loose skin.
Loose skin is tough to get rid of. Weight loss and exercise definitely helps. However, the best way to get rid of it, if you've done all that and it's just not going away, is to do a tummy tuck.
Dr. Shah says not many women will notice loose skin after their first or even second pregnancy, but the more pregnancies you have, the chance of getting loose skin increases. Are you overindulging this